my email address.
Hello, everyone, and welcome to CESLC Insider, where you can tune in every other Wednesday to find education on topics that matter to you. I'm your host, Angelique Jackson, Manager of Business Development and Marketing here on campus. And here at Charles E. Smith Life Communities, we deliver exceptional care experiences tailored to the individuals that we serve. If you would like to learn more about our residences or to schedule a tour, you can call. We'll have the phone number to call for a tour in the chat, as well as the link on our email address, or on our website, excuse me, if you'd like to schedule a tour that way. Also, before we get started, I just have a few reminders. We will be recording this program today, and the recorded version will be uploaded to YouTube. We will have the link for you in the chat. You can find this event and many other events that we have recorded as well. And also, this program qualifies for one Category 1 continuing education unit for social workers. So if you are a social worker and you would like a certificate after watching this program, please email Amanda Painter. Her email address will also be in the chat for you, and give us about 7 to 10 business days to email your certificate. We really do appreciate your patience. It's also important, if you would like a certificate, that the name you would like to appear on your certificate must match the name that you use to register for the event, as well as to log in to view the event. And I think I've covered everything. And again, if you have any additional questions, please put them in the chat. We really look forward to getting to your questions. And so let's get started. Today we have Kathleen McGinnis, the Director of Community Relations at Smith Life Home Care. She's joining us for our final Insider of 2021, and she's going to educate us on what we need to know before selecting a home health aide. Kathleen, thank you so much for joining us today. And why don't you just tell us a little bit about yourself and, tell us why you're so passionate about serving older adults in our community.
Okay. Well, good morning, everyone. I'm very excited to be here with you today. As Angelique said, my name is Kathleen McGinnis. I'm Director with Smith Life Home Care, and I've been here a little over 5 years with Smith Life Home Care. And part of the reason I'm so passionate about older adults is, like many other people, it started with my own family. 30 years ago, my mother-in-law moved in with me. That wasn't fun, but I did begin taking care of her, and after 7 years, she passed away. So that was my first experience with older adult care. Subsequently, my mother and father became ill. One lived in McLean, one lived in Friendship Heights, and my brother conveniently lived in Paris. So I began taking care of them and learning as much as I could on how I could support them when I was still trying to work full time, and so I found it very challenging. I had to actually close my own marketing company to take care of them full time. So today we're going to talk about how you can still have a life and know that your loved ones are safe and being cared for.
Very important.
Yeah. In the process of learning more about home care, I became a certified dementia practitioner in the last 5 years. I became an end-of-life specialist certified through Montgomery County Hospice. And I also became a home safety expert on what you should look for in your home to keep our loved ones from tripping, falling, and that's a free service of Smith Life Home Care.
So what are some signs, Kathleen, that it might be time to hire somebody from maybe a company like Smith Life Home Care?
So the signs I found and that we recommend are notice the changes in your loved one or older adult. My husband had Parkinson's and frontotemporal dementia, and I noticed as the disease progressed, you know, he wasn't changing his clothes as often as he should. He wasn't showering as frequently as he could. Small tasks like loading the dishwasher. He would load the dishwasher, but he would fall over. So we took away that task. You know the person in your home best, and you know these small changes that somebody else would not notice.
So what kind of care and services does a home care agency provide?
So first, when you're thinking about choosing a home care agency, I recommend that you consult with your friends and neighbors that have an agency that they use. Of course, I hope you choose Smith Life Home Care, but it's important that you do your due diligence. When I was hiring home care for my family many years ago, I hired private duty aides, I hired licensed agency caregivers, I hired people through care.com, and I had a very diversified experience in the care that my family received. So Smith Life Home Care is an agency, and they will provide certified nursing assistants that have been bonded or that are bonded, licensed, insured, receive extensive training, are certified by the state of Maryland, and receive 8 hours orientation onboarding here. Every Wednesday, we onboard new caregivers. And the process, you should do your due diligence and interview at least 2 agencies in the community, because everybody offers different services, and with a caregiver shortage, you will find that many agencies have minimums for care, and that may or may not fit with your personal needs.
So what areas does Smith Life Home Care provide service?
So Smith Life Home Care, along with other care companies, provides care on the Charles E. Smith Life Communities campus in all of our buildings here. We also provide care in Montgomery County and in Washington, D.C. Smith Life Home Care recipients on the campus of Charles E. Smith have very exclusive services. They are able to avail themselves of our Independence Plus program, which provides assistance when you need it and independence when you do not need it. It's unusual. It's 30 minutes of care. It's an hour of care if you need it. We have significant volume on this campus, and that's part of the benefits of being on this community or living in this community, is having Smith Life Home Care be able to give you 1 hour service in the morning and 1 hour service in the evening if you're in independent living. Or if you're in the Hebrew home and you need safety sitting because your loved one has dementia and they don't know that they've broken their hip and they need to stay put. Having a safety sitter here in the Hebrew home or anywhere you are in the community is something we can provide very quickly. And we can also provide those in other hospitals, Suburban Hospital, Holy Cross, any area hospital that's in Montgomery County or Washington, D.C.
Now, when it comes to the process of screening and selecting and even matching a caregiver to a family, can you explain that process to us?
Yes. So our caregiver process of onboarding, screening, is very thorough. They're caring for very important people in your home, or my husband, my mom, my dad. So you want to make sure that they have been thoroughly vetted. They have a background check, their driver's license is checked to make sure that there's nothing irregular on their driver's license for the last 5 years. No DUIs, speeding tickets, nothing. So the other onboarding that's part of the process for screening is they need to make sure that they have their CPR, they need to have their tuberculosis, they need to have their COVID vaccines, they need to have their Maryland certification that they're a certified nursing assistant. They need to have at least 2 years of training in the community, at a senior living facility, at a hospital, at a rehab. We want them to have that whole background of experience before we hire them to go into your home.
Sure.
We also have kosher training for our caregivers so that they can be respectful of your home and what's important to you. We also are certified SAGE, and our caregivers are certified in LGBTQ community training so that they are aware of any cultural nuances and that they're respectful of what's appropriate in your home.
Oh, that's wonderful. So they are really ready by the time you match them with a family that needs their assistance.
Yes. When we try to match up a family, not only do we try to match them up with whatever their needs are, are they kosher? Do they live in Germantown? Do they live in Georgetown? We want to select a caregiver in a relative close proximity to your location so that we don't have bus issues, driving issues. In a perfect world, that's our first go-to. We look at a 5-mile radius, and we have over 275 caregivers, so we have a lot of choices. We do have caregivers that speak Spanish. We do have caregivers that speak Tagalog, Philippine language. We don't have as many as we would like that speak, that are multi-language, but we also look for that when we're hiring.
Oh, wow. So it sounds like that you've got a real diverse group.
When you're
We do.
speaking, excuse me, who's the person in black? When you speak to, no, in black. When you speak, when you turn your face to her, we can't hear you because you're not.
Sorry.
So we can hear Kathleen, but we can't hear you.
Okay, thank you for that feedback. I appreciate that.
I'm used to talking to my dad, who was deaf, and I'm a shouter.
And I was always told to be quiet when I was a child.
Thanks for letting us know.
Thank you very much. We appreciate that. I think we covered the kind of training provided for caregivers when they go out to assist folks in the community who need them. Now, in the instance, you know, you've matched a caregiver. Will it be the same caregiver, or is it a different caregiver every time?
In a perfect world, it's the same caregiver every time. We have put minimums in place to help ensure that. Ever since COVID hit, there's been a shortage of caregivers, there's a shortage of all workers in the industry. Our current minimum is 5 hours, 3 days a week. That's enough work so that our caregivers will stick with the client for the life cycle of that client. You will find different caregivers. Often we will get a call now, and I need to provide a caregiver at 8 o'clock tonight, and they need 24/7 care. And it takes sometimes a little bit of time to get that perfect team in place. So when you're starting service, you may have 2 or 3 different caregivers until we can pull everything in place. That usually takes somewhere between 2 to 3 days, depending on where the care person is located, if it's 12 hours of care, if it's 24/7 hours of care. There's a lot of variables, but our goal is always to have the same caregiver. Most families should know that the during the week caregiver is generally a different person, different workforce market than the weekend people. So if you're having 24/7 care, for instance, that would look like 2 12-hour shifts, Monday through Thursday. That would be 2 people, 2 12-hour shifts. We absorb the 8 hours of overtime that is occurred in those 48 hours, the first 4 days of 24/7 care. Many other companies do not, but we feel like that's the cost of doing business to keep the same caregivers there. Then Thursday, Friday, Saturday, again, 2 12-hour shifts, and they would be 2 additional caregivers. So you'd have a unit of 4 caregivers providing care to your family member. And it's helpful to have more than one so that you have a backup who's familiar with your family. That is part of the reason people hire an agency, because if you have a off-market caregiver and they are ill or their kids are home from school, you don't have a backup. We have 275 people on our team to back you up.
So that really puts things into perspective, especially hiring a caregiving agency when you're, yourself a caregiver or family member. And
Yes, yes.
so that's 24 hours a day nonstop, whereas Smith Life will have a whole team.
Right. You have a team. You have a team of caregivers that work for you in your home. You also have a team in the office. You have an office manager who is assigned to your case. You have a care coordinator who is assigned to your case. You have a client liaison manager who is assigned to your case. And you have my personal cell phone, which people call frequently, evenings and weekends, to make sure that you get what you need. I have been a family caregiver for many years, and it is a very demanding job, and your care needs don't happen at 11 o'clock on a Wednesday morning. They happen on weekends and evenings. That's why we have a 24/7 line, so you can reach somebody at all times. So whatever agency you hire, make sure that they have a 24/7 phone line and that a human is answering it. Our team answers that phone. One of us is on call 7 days a week, 24 hours, holidays, etc.
Dedication.
Yes, we are dedicated to making sure our families and Charles E. Smith families get exactly what they need.
So are there services that your caregivers are unable to provide?
Yes. So our caregivers are certified nursing assistants, and that means that they cannot do any kind of care that goes inside the body. So any shots, no needles, you'd need an LPN or an RN for that. For catheters, they can empty the catheter bag. I don't want to say I'm an expert, but yes.
Yes, you are.
Yes, I am. So they cannot change the catheter. They can feed people. They cannot give them their actual medication. We have pill boxes that we give our clients. They will give them a reminder, and they will put that pill box in their hand, open up that pill for that morning or that evening, and point to it. Legally, they're not allowed to put the medication in their mouth. That's the law.
So it sounds like, too, that helps your clients still maintain what functional status that they have.
Yes, when you say functional status, what
meaning like, the dexterity to open the pill.
Yes, excellent point, Angelique. Angelique is a nurse. She knows it all. So yes, we also have pill boxes that we can order for families that lock. We have some people, like my father, who would like to take all the medication in one day so he doesn't have to worry about it the rest of the week. This is not a good thing. So we got Daddy a locking pillbox case. So he has to wait every day for his medication.
So we talked about the services that caregivers cannot provide. Now let's talk about how one determines services that they need and the amount of caregiver hours that they should have. How do you guys go about assisting your clients with this?
So we have, first of all, we do a family interview. We're happy to do a Zoom with the brother, the sister. People live all over the country. So we have an interview with the family, and I'm able to sort of determine from that call. We also have 3 nurses on our team. Our nurse will do a nursing assessment before care starts. She would write a care plan for the caregivers to follow. This is a free visit. Many companies charge $75 for that visit. Again, we consider it the cost of doing business and being able to write a good individual care plan that our caregivers follow. So our nurse comes to the home and makes that determination. You can also have a social worker help you make that determination, or when they're discharged from a rehab from the Heber home, from Sibley Hospital, that social worker there will tell that family member, we recommend 24/7 care for the first week. Then you can taper down to 12 hours. And then after a month, you could go back to 5 hours a day or whatever it is. That's appropriate for each family member. And you should know with our services, all you need to do is tell us in 24 hours if you need to reduce your service.
Okay.
And the caveat with that is life happens. You know, if my dad or mom fell, I don't usually need care for them the rest of the day. You should know that the caregiver can go with them to the hospital, to the emergency room, if you live like my brother did in Paris, conveniently. They could go with the caregiver, could go with the family member to the hospital, stay with them through the intake process and wait until the family member can arrive, or just stay there with them. Or you could cancel service. You just tell us mom or dad has had an accident, they've gone to the hospital, services will stop.
A lot of support.
It is.
A lot of support. So are your services covered by insurance, and are there any programs to assist with the cost?
You have the best questions, Angelique. Yes, we do have, most home care, private duty care is not, repeat, not paid for by Medicare. What does pay for care at home is long-term care insurance. All of them have a different deductible. When we meet with the family, we find out about this long-term care insurance option. Our nurse will have to do an assessment. She will provide that to the long-term care insurance company. We facilitate the process. You can have the long-term care insurance company pay Smith Life Home Care or whomever your agency may be, and then you pay the differential. For instance, your long-term care insurance may pay $300 a day, but you have $400 a day of home care. So the long-term care insurance, we have a form, you endorse it over to the home care company, and then we bill you for the differential of $100. It's one less thing for you to have to figure out as a family member.
Yeah.
The other program that is unique to Montgomery County only is, it's a wonderful program that many people are not taking advantage of. It's ARC Respite Montgomery County. That is when one family member, like myself, taking care of my spouse at home, and the family member has to be over 62. I don't look like I'm over 62, but I am. Just kidding. Sorry. So you have to be over 62, and if it's a brother taking care of a sister taking care of another sister, wife, husband, daughter, any family member, and you have to live in the same household. This Montgomery County Respite Grant Funds will pay up to 40 hours a month of almost free care. They reimburse $26 an hour of care. Our basic rate for Montgomery County is $27.95 per hour for care.
Okay.
But this is a beautiful thing for somebody who is just starting care. So if you needed 8 hours every Friday, you get the day out of your home for whatever it is that you need to do, your own medical appointments or shopping or some kind of refreshing your emotional energy. You could do 8 hours up to 40 hours a month, and that care is essentially paid for in Montgomery County only. You cannot be on Medicaid or any other subsidized program. When families call us, we help facilitate the application for ARC. It's good for approximately 120 hours or 40 hours a month for 3 months. So it helps build a bridge to those people who are just starting care.
Thank you so much for sharing that resource with our viewers.
It is a great resource, and you have to be able to document that you live in the same home, and I'm happy to walk you through the process. We work with them often. We get lots of referrals from ARC Respite Care in Montgomery County. So those are the two programs, long-term care insurance, ARC Respite Care, and the other is VA Aide in Attendance. For those veterans out there, my father was a veteran. That's also another form of reimbursement for care.
Also resources for veterans.
Yes. We will also, if you have a private duty caregiver in your home, we will also hire that private duty caregiver, if she's amenable to that, to become a part of our workforce, so that you have the backup of a large, an agency that's committed to you, and the backup teams for when somebody's sick or whatever the need may be.
And that's very helpful, especially, a family has a trusted caregiver that's, kind of independent of any agency.
Right.
I think it's wonderful that, they could have the support of Smith Life Home Care.
Right. Again, they have to be a certified nursing assistant licensed by the state of Maryland. We do not hire anyone that is not licensed by the state of Maryland, along with the other parameters we have for hire.
Now, do your clients need to sign a contract with your agency when they begin service?
Our clients sign an agreement for services. It is essentially a non-binding agreement that can be canceled within 24 hours. As you can imagine, we have a very diverse group of people we care for.
Mm-hmm.
If somebody passes away, obviously you're not responsible for any care agreement. And all we require is 24 hours notice in writing. So it is an agreement, it is HIPAA protected, there must be a guarantor for payment, there must be 2 signers of this agreement. Generally, that's the care recipient, and it is a family member, usually the power of attorney, who also guarantees that payment will be made to Smith Life Home Care.
Now, what other supportive services are available to your clients and their families? Because obviously the families need a lot of great deal of support as well.
They do. So I found well, actually many of these packages came about but by a personal need that I had in my own home. So I came up with a home and settle package, and they'll provide you with these. This one is $135 for 5 hours of a certified nursing assistant. So hypothetically, when my husband needed to go have his catheter changed, so I didn't have to take a day off work, I would hire a certified nursing assistant from Smith Life Home Care for $135. They would pick him up at our home or at his assisted living or at hospital or nursing home. They take them to their urologist or whatever medical appointment they may need. They wait for them. They get the procedure done, and the caregiver takes them home, makes sure they're back in their home and in their jammies or whatever, cup of soup, boom, they're done. Anytime I've asked my children to do that favor, it has cost me at least $200. They're millennials. They're very busy. So this is a great price. We also have the transition to home, which is $475, which is great for knee and hip replacements. This is 6 hours of care for 3 days. It's great when they're being discharged from any hospital, any rehab. They're really not sure how much care they need, so this is a flat price. They can, of course, extend care. They can have more care, but it's a good package price. And I did this when my husband had knee surgery, and I didn't want to make a big commitment, so I just felt like this would be a good thing. So that's why we have it for the community.
And I'm sure that additional support after a hospital stay really helps.
It does. It does. It really takes most loved ones several days to sort of settle down after they've had a hospital experience. They have dementia. The dementia will somewhat ratchet up, and it takes some time for them to reorient when they come home. And having that extra support was peace of mind for me, that I didn't have to worry. that he might fall or try to do things he shouldn't do.
I can imagine. So I think I've asked this, but did I ask this? How often will someone from the agency call to see if the services?
No, thank you for asking that question. So whatever agency you hire should have a process to check in on you. And I see questions populating. We're going to get to your questions at the end of this, so stay tuned. So someone on our team, after your initial intake is done with myself for Montgomery County, or Allison Butler for Washington, D.C., or Layla Henderson for on-campus care, you will be called within 24 hours, within 7 days, 30 days, and then 90 days. On the other side of that coin, your caregiver is also called by our HR person to make sure, sometimes we find within 7 days that the family has 5 hours of care and they really need 8 hours of care every day. Our caregivers are experienced and trained, and if you can afford it, whether you can afford it or not, we're going to make a recommendation that your care is excellent, your care services need to be reduced, or they might need to be increased. So that's what you can count on from us. Whomever you interview for home care should give you a consistent plan for checking in to make sure your needs are being met.
So you mentioned your 24/7 phone number, and that they can reach a member of the team at any time.
Yes.
How long will it take somebody from your team to return that call? Because as you know, things happen, emergencies happen, and, you know,
Right, they
support
do.
is needed.
That is absolutely correct. So our phone is answered by a member of our team, and they are on call 24/7. So generally, it is answered when it rings. If for any reason you get our recording because they happen to be on the phone with another client, then just leave a voicemail and someone will be back to you in 15 minutes. We also tell our clients, this is our staff. They have families, they have children that wake up at night. So if you're calling to change your schedule, don't call at 2 a.m. Call between 7 a.m. and 10 p.m. We answer, boom, quick like that. And because we know that sometimes social workers don't tell families that nurses, doctors, whomever may be on the discharge part of it, they don't tell them until 3 hours, and then they say, you're being discharged tonight at 7 p.m. Well, you could get on the phone and call us. You will find myself or someone at 301-816-5020 on the end of that phone call, a live human being.
Live human being, that's important.
Yes.
So who usually coordinates the care with the support, the family and your clients and the support team?
So that's done in-house. That is part of the reason why agency care is more expensive than private duty care in the marketplace, for instance. There's a significant amount of oversight. There's recurrent nurse visits that are mandated by state. So who will oversee the care is you're assigned a nurse. You are given the office manager's cell phone number and the 24/7 line. You're given a care coordinator's phone number and cell phone number, and you have my cell phone number. I have been called on weekends for the last 5 years, and I love it. We provide a very important service, and it's important to know someone will be there for you.
I really admire your dedication.
Well, thank you.
So you kind of touched about services that are available exclusive to the residents here on campus at Charles E. Smith Life Communities.
Mm-hmm.
Can we talk about those?
Yes. So the residents here on campus have a unique opportunity to become part of the Independence Plus program, which is a very special program on campus, and they're allowed to have flex care. People off campus don't have this option except one new place where we'll be starting a program in Friendship Heights on February 1st. But
Exciting.
let's talk about on campus, where they can have medication management, they can have cleaning services. We have a program called Sparkling Clean. It's $55 for an initial visit, and then $27 after that. So if you want your loved one's apartment cleaned in Ring House or Revit's or wherever they might be, you have that option. We have a safety check. If you just need them checked on for 10 minutes at night, that can be provided fee for service, but it's approximately 10 minutes, $10. Assistance with dressing, assistance with showering. We have a large population in Ring House that just needs little tweaks of assistance as it's independent living, and we're happy to provide that. It's a unique program that also allows them to experience all of the incredible programs that Charles E. Smith Communities offers, like getting a CEU credit today at no cost. So it's, this is an incredible 38-acre campus here, and we're honored to be of service to our community here.
Yes, we are. We are. Thank you for that. And then before we get to our questions, I'll just ask, how can someone set up care today?
Set up care today. Call 301-816-5020 and tell them you're looking to start service in Montgomery County, Washington, D.C., or Charles E. Smith Life Communities. The different people within our team manage different locations. We're happy to help you. Normal business hours would be great. Doesn't happen that often, but feel free to give us a call after 6 o'clock. I had a woman call me this morning who needed 24/7 for her mother who's being discharged from Suburban, and we will start 24/7 care at 8 p.m. tonight. I can't always do that. 12 to 24 hours is great. Again, if you're on campus, you should be able to call us, or you can email me. I believe they're going to put my email and other email addresses for people you need to contact for immediate service. You have a loved one that just checked into the Hebrew home tomorrow and they need safety sitting because they don't realize they shouldn't get out of bed. We can take care of that usually within 2-4 hours-ish. That's what we do.
Thank you. All right, let's get to to my favorite part, is the questions from you guys in the audience. And
I have a question.
Our first question.
Oh, I have a question.
Oh, if you could please put your question in the chat. Thank you so much, and we'll be able to get to it. Thank you. So our first question is, where do you get certified in home safety?
There are services in this area that are certifying agencies. You can do it online or you can do it in person, and we'll provide a link after this session.
Great.
I don't know how to do chat. I don't see chat. I see mute, start video.
Okay, I'm sorry. Yeah, go ahead. I'm sorry.
Oh,
Go ahead
okay.
and ask your question.
Supposing that the match is not right, how soon or how often or whatever can you make a change with the?
You should be able to expect a change within 24 hours. You should call either our home care company or whatever home care company you're with. Let them know for whatever reason it's not the right fit. It's it's no harm, no foul. If it is a personality or some aspect, the staff member is late, whatever it may be, it's important that you let the office manager know that so that they can do some coaching and counseling with that caregiver. If it's just a wrong personality fit, you should expect a change within 24 hours, 48 hours at the most.
Thank you.
Thank you for your question. Okay, so next question. Hold on here. Do you provide any Medicaid in-home services? I think we answered.
good question.
Yeah.
No, unfortunately, we do not provide any Medicaid in-home services. There are agencies in this area that do accept Medicaid for payment. Unfortunately, we are not one of them yet.
Thank you so much for that question.
One
Our next
time,
question is,
sorry, go ahead.
our next question is the ARC, the 40 hours a month for 3 months, is that per year?
Yes, ARC operates on a fiscal calendar, which means July 1 to July 1. So towards the end of the year, it's a nonprofit grant. They tend to run out of money. So by May and June, the money gets tight. So if you have a need or think there might be one, if it were me, I would apply now so that you receive the grant funds. And even if you don't need to use them until April or May, hypothetically. So yes, generally what's approved, and it is an approval process, is 40 hours for 1 month for 3 months. A maximum of 120 hours is generally granted by ARC Respite. And that's my experience in the last 5 years working with that, subject to change.
Thank you. Great question. So what if you don't have long-term care insurance? What is the cost of care?
So the cost of care, as you will find if you do your due diligence before hiring an agency, is different for almost every agency in this area. And there are over 400 home care agencies in this area. However, Smith Life Home Care is one of the top 5. Top 2, in my opinion.
Yeah.
So pricing, on campus, Charles E. Smith Life Communities, you would expect to pay $26.45 an hour. That is a deeply discounted rate that is generally not provided by other agencies. Off campus, you would generally expect to pay in Montgomery County $27.95 to $28.95 an hour in Montgomery County, depending on where you're located, because gas is expensive. In Washington, D.C., it's $28.95 to $29.95 per hour. And generally speaking, when I do my secret shopper, we are the least expensive agency often out there.
So the ARC funds, it can get pretty costly, so that
It can.
added resource with ARC and
Yes.
the VA.
ARC, the VA, or long-term care insurance is a big help. And I see it. The next question.
Are home care costs tax deductible, which is a great question.
Yes, it is. Of course, you should check with your tax accountant. They are deductible. But everyone should check with your accountant. I'm not a tax expert. I can just say I deducted them and nobody said anything yet.
So what questions should a family ask when looking for a caregiving agency?
Well, some of those we discussed in the beginning of the program. You know, who will follow up with you? Are the caregivers licensed, insured, tested, vaccinated, driver's license? You know, there's a very large process that agencies ensure is in place to make sure you're receiving a safe, well caregiver. So you would, as I said earlier, you know, ask family, ask people in your community, go on Nextdoor. You can certainly look at our Yelp and our Google results. We have lots of testimonials, and we have helped hundreds of families over the past 22 years. You know, you want to make sure that they're with the Better Business Bureau, and that you're hiring a reputable company to care for your loved one, that they're going to show up. What would they do if somebody doesn't show up? You know, there has to be a quick process in place. We use electronic software, and it's GPS enabled. So, in real life, if that caregiver is not clocked in within 10 minutes of her time, you should be called to say, Susie is running late, or, Susie is giving your phone number so that she should also call you.
Well, that would be helpful. So our next question, someone who has a feeding tube, who's not able to speak or walk, what kind of arrangement is needed for bringing them home, and how many hours of service might they need? It's a big, long question.
Yeah, that's a complicated question. There's going to be multiple nurses involved in that, and more than likely, I would encourage a geriatric social worker. We work with many in the community. A feeding tube, caregivers cannot do, our certified nursing assistants cannot do a feeding tube. What hospitals and rehabs generally do is they teach the family members how to do the JPEG or feeding tube. So people hypothetically, are fed 3 times a day, 2 times a day. So if a family member can be there, you can minimize your cost for care. But you do want to make sure that there is, constant monitoring. I can't remember that if they said that they couldn't move. Can you go up to that question? Not able to speak and walk.
Right.
So if they can move, then, you get the rotating. You want to make sure that they don't get bed sores. That's all encompassing care. And I couldn't guess how many hours of care that individual would need. That would be a nurse, probably a social worker, and I would generally say most people that we care for with feeding tubes are 12 hours a day.
Thank you. Thank you. I think our next question is, how much do you charge per hour? I know we discussed that.
Do you want me to say it again?
Yeah.
Okay. We charge $26.45 on the Charles E. Smith Life Communities campus. Very excellent price for very good care. Off campus, Montgomery County, $27.95 or $28.95, depending on, some people are in far reaches, tip of PG County, so that would probably be $28.95. Washington, D.C., there's different licensing requirements, HHAs, home health aides, and CNAs. That's $28.95 or $29.95, again, depending on where the geographic is located.
And it's nice to know that you service such a large area.
It is.
Such a large area.
We do service parts of PG County, but not all of PG County.
So I think that's all for our questions.
I have a question.
I'm sorry?
I don't know how to do chat. I don't see it here. I have no idea. This is a rhetorical question. You do not allow somebody that has a problem to come one time. They have to sign some kind of a thing to come, like for 5 days, 100 days. If you need something all of a sudden, and there's nobody around, can you send somebody or no?
Yeah, can we, this transition to home package or medical appointment package, if you just need somebody for 1 day for 5 hours and you don't need them ever again, that's the package I would recommend. And you get a certified nursing assistant, a driver, and we're going to put some of these products that, when you become a client with Smith Life Home Care, you receive this product full of paper if you want, or you receive the documents electronically. So, you can feel free to give me a call afterwards if you have a specific question about care. I'm happy to answer it.
Can you tell me your last name again? It's Kathleen?
Kathleen Mahoney McGinnis.
Mahoney McGinnis. Thank you.
McGinnis. You're welcome.
A nice Jewish woman working at the Smith Life Communities.
I know, isn't that great? We welcome all cultures and faiths here on this community.
Yes,
So
and
I've
met you in person a number of times. A quick question. the person sitting next to you, I've seen two names. One is Sandra Williams. Who is that? Is that you, or who is that somebody else? Who is that?
I'm Angelique Jackson. I'm not sure who Sandra Williams is. Does anybody know?
Somebody put
Yeah,
that
I'm
in
Angelique Jackson.
somebody put that email in the chat, and I was wondering who that was. Oh, well, I'll ignore it.
Well, we apologize. We're not.
I think that was an individual.
It says
Yeah,
Sandra
that's right.
Williams
Might be
is,
somebody who's on the chat.
Yeah.
oh, okay, thank you. Thank you. And Angelica,
Thank
your role at the Charles E. Smith again is what specific?
Oh, Manager of Business Development and Marketing.
Okay. And you also manage the DC, is that your number that was in for DC? Or,
No, that is Allison Butler. She works for Smith Life Home Care, and she covers the DC service area. So
Okay.
if you need in-home services, she's your
no,
gal.
I live like 10 minutes from there where you are in Bethesda. So
I'm
thank
your
you.
person, Kathleen McGinnis, Montgomery
Yes, I know.
County. So that would
Okay.
be we're sister companies. Smith Life Home Care is a sister company to Charles E. Smith Life Communities, and we work very closely together, obviously. Angelique is, I don't need to say that, sorry. Angelique is Charles E. Smith Life Communities. I'm Smith Life Home Care.
Yeah,
So you're
and
actually
then this-
on campus. If you're living on campus, is Angelique what you manage, correct?
yes.
And we actually have 2 offices on campus and 1 in Washington, DC.
Okay, well, in the old days, pre-COVID, when I was up at the JCC exercising 3 times a week, I was right next door to you. And I had an aunt who lived at the original Hebrew home long before there was the huge campus, but that was many years ago. Anyway, thank you for the presentation today. I understand much more than I did before.
Well, thank you. I'm glad to hear that. We're glad that we were able to assist. Thanks for your question. We have another question. Are there any type of home care agents that can provide services for going inside of the body, or would that be a nurse? I think
Yeah, that would be a nurse.
Yeah.
You would need to hire, and there's a very large registry for nurses. We can suggest companies that do just nursing, but yes, you would need a nurse for that.
Okay, and then thank you. Is there a company in Virginia that you recommend, Kathleen?
Yes, if you email me, I can tell you who I would recommend in Virginia. KMM@SmithLifeHomeCare.com. But I'd rather they move to Maryland so that we could help them. In lieu of that, I do have a company I work with in Virginia. And the next question is, what is the name of the campus person? That is Layla Henderson.
Sorry about me.
Oh, did you mean
No.
business development, or did you mean Smith Life person, Michael Zed?
Well, you might as well just tell them about Layla on campus.
Okay.
Yeah, Layla Henderson. I think we have some more questions.
The Smith Life person. Okay. Leyla, right?
Layla, yes.
Layla.
Yes, we'll show that at the end of the program. I'll just repeat it briefly now so that everybody, it will shorten your call. If you're calling to inquire about services on campus at the 816-5020 number, you would ask for Layla Henderson for services on campus. You would ask for Kathleen Mahoney McGinnis for Montgomery County, and you would ask for Allison Butler for home care services in Washington, D.C. If you can't remember that, don't worry about it. We're happy to help you. We'll direct your call.
And all that information, again, is in the chat. So is there, I guess we'll be closing soon. Is there anything else that you want to share with us?
No, just, it's really an honor and a privilege to be able to serve our older adult community and be able to give back. We really appreciate the opportunity to speak to you all today. And Angelique, thank you for hosting us here today. We're grateful.
And thank you, Kathleen, for such an insightful discussion. And thank you, everyone who tuned in. Much appreciated. I also wanted to remind you that our first Insider of 2022 will be January the 12th, this time at 11 a.m. I know it's a little bit of a time difference, but just 1 hour. And then Sydney Palinkas from Elder Safe Center will join us to discuss the importance of practicing mindfulness for our general well-being. Such a great topic to start off 2022. And again, thank you so much for tuning in, and I hope you have a safe and wonderful holiday. Thank you.
you.
Bye.
Thank you. Bye.
Thank you.
Thank you. Excellent, Angelique and Kathleen.
Thank you.